Thank you, Vanessa. Miss Nelda, can I use this? Okay. Miss Nelda had some fancy equipment for me, and I wasn't really skilled at keeping it on my ear and getting it tucked in, so I'll just use this mic. First of all, thank you all for coming today. I see so many CBMC friends in the audience, and I hear Vanessa talk about our library friends, and we could not be more proud of our partnership with the library. The Community Links program has really allowed us to take health information out into our community in a way that's interesting, hopefully to you, and in a way that's inviting by having this partnership here with the library. So Dr. Spears, thank you so much for the partnership. I know Vanessa works hard to make these successful, and it's always nice to come in and see a warm group of friends here to talk with today. We're going to be very informal today. Dr. McCullough and I are going to kind of get us kicked off, and then we've got the real experts. We've got our nursing home administrator and DON and our team here. They're going to be able to talk to you, answer questions. Many of you have been on TCU and visited friends and family on TCU, so you'll know a lot about transitional care. But today, what we really want you to take away is there are so many choices now in healthcare. And when you go to Coosa Valley to have a procedure, TCU is an option for you in terms of recovery and strength building and skilled care. But also, if you choose to go to another hospital for care, TCU is an option for you. And that's what we want you to take away today, is it's not just being at Coosa Valley. Even if you don't start with us, you can finish with us. You know, we hear all of our lives about finishing strong, and that strong finish is important in healthcare, and that's what TCU provides for you, is a strong finish to any procedure, any surgical procedure, any IV antibiotics that you might need, or IV infusions. And so we're going to talk a little bit more about that. Dr. McCullough, you want to join me up here, and we'll just kind of walk through this together? We are so appreciative of Dr. McCullough being here with us today. Every time we turn around, we ask him to come on in and join us, so we're proud to have him. All right, let's see. Okay, so many of you already know, just by show of hands, tell me, have you been to TCU? Raise your hand if you've been to TCU, if you know where we're talking about. Okay, so a few of you have been, not as many as I thought. Transitional care is located on the second floor of the hospital. We opened our new hospital in 2007, and as a part of that 2007 opening, we went in and renovated two main parts of our older facility, and TCU was one of those. So TCU is a 35-bed unit. When we did that renovation, we had all private rooms placed in TCU, and that's certainly a nice accommodation when you look at space, not having to share rooms with others. In addition to the private rooms, being a hospital-based skilled unit, CBMC has access to a lot of resources that a nursing home skilled unit may not have access to. And our long-term care team can talk to you a little bit about that too as we go on this afternoon. 24-hour medical care, of course, fully equipped rehab. We have our rehab experts here this afternoon to talk through that with you. An activities room, and really the main goal that we wanted you to take away from this is that our unit is as equipped as any other unit that you'll find in the state in terms of resources. And that's really important for you when you're considering recovery and rehab. Comprehensive care, there are so many things that fall into the skilled care bucket. So when you think about skilled care, what's the number one thing we often think about? Orthopedics, you think about having an elbow or a knee or a shoulder work done, and certainly those are the diagnoses we think about for rehab, but all of these other things are included. And therapy is a huge part of skilled nursing. And those therapies include occupational therapy, physical therapy, speech therapy, and then we have all other disciplines included in terms of nutritional management, wound care, specialized activities. And what we mean by that is targeted activities for your needs. Because one of the things we believe we do best is we do targeted individual plans of care. And while we're not perfect in delivering services, we work really hard to individualize plans of care. Because the plan of care for one patient is not necessarily suitable for the next patient. We provide respite care, long-term care, financial counseling. Golly, how complicated is dealing with health insurance companies and the financial counseling piece of that. It's pretty complicated. And we have experts on our campus that can help you walk through those details. And then one of the things that we are very proud of is that we work with you on an individualized plan of care. And that's particularly important to help you be successful at home. We're going to help strengthen you, get you back to the highest functioning status that we can, and then we want you to be successful once you get home. And that's part of the discharge planning piece. When you look at the TCU admission criteria, you might be asking yourself, so how can I go to TCU and get some of this great therapy? Well, a minimum 3-day hospital stay is required in order for you to come to rehab. You have to have a 3-day qualifying stay, we call it. And that stay has to be within the last 30 days of the TCU admission. Admission criteria also includes the medical conditions that warrant skilled nursing and rehab. And guys, those are the things that we've talked about. Those are those orthopedic procedures. Sometimes we need IV infusion for nutrition or antibiotics to help fight long-term infections, and all of those are considered skilled nursing activities. Medicare Part A and Part B certainly helps cover the services. Part A in particular for the SNF component, the skilled nursing care, and then Part B is really important when we start talking about discharge and DME coverage and making sure you have follow-up after that discharge. And Vanessa said to me last week, and she said to me again late last week, and today, this is Vanessa's passion for us, and that is, we want you to come back home. I said, Vanessa, what is the main takeaway you want us to have next Monday? She said, I want them to know they can come back home. So while we want you to choose us for every single healthcare need that you have, we recognize there are some of those needs we can't meet. And that's okay. If you go to another facility to have a procedure done or to get a service that we don't necessarily offer, we want you to come back to us if you need rehab. And let me tell you a really important piece of that. If you're in a Birmingham facility and you say, I want to go to Sylacauga for my rehab, saying that you want to go to Sylacauga may not necessarily get you to Coosa Valley. So Coosa Valley is the really key words there. Those are the really key words in getting back to our transitional care unit. So letting your case managers at the other facility know, I want to come back home, I want to come to Coosa Valley. And that lets them know that you're talking about CDMC skilled care unit. We've talked a lot about what skilled nursing is, and remember, skilled nursing is a Part A benefit under Medicare. And usually, patients will qualify for up to 20 days of care if they meet the admission criteria to the unit, and that's 20 days without copays. Acute medical conditions fall under that. Certainly, we take patients on TCU that have had abdominal surgeries. We take patients on TCU that have had cardiac surgeries, post-op heart patients. We also take stroke patients on TCU. We've had some great success. You guys know on our ER side, you've seen the work that our ER team has done in really readying our community to be responsive to strokes that come into the emergency department. And we know that treating strokes fast allows patients to have the best recovery. Well, the next piece of that is this skilled nursing care and helping you get back to that optimum level of functioning. Certainly, we help with terminal care, end-of-life care. TCU offers benefits there. General rehabilitation, wound care, and custodial care. So it's a pretty broad range, as you can see, as are available. How do you know if TCU is for you? So y'all are telling me you have these great services. I have some healthcare needs. Now, how do I know if I qualify for your unit? Well, some of the things that we look at when we see if you qualify for skilled care is, can you safely use a cane, walker, or crutches before you go home from the hospital? Can you get in and out of a chair or a bed without needing much help? Can you walk around enough that you'll be able to move safely between your sleeping area, your bathroom, and your kitchen? Can you go up and down stairs? And if there's no other way in your home, to avoid them. And then some factors that can also help prevent you from going directly home from the hospital are, because of where you live, you need to be stronger or more mobile before going home. Maybe you live independently and you need strength training. Medical problems such as diabetes, lung issues, heart issues that are not well controlled. That's an environment where we can help stabilize you and teach you what you need to know about how to take care of yourself. Medicines that cannot be safely given at home. So there are some medicines today that are not safely given at home. And those medications we can help you with, finish up the last few doses on this skilled unit. And then surgical wounds that need frequent care. So sometimes we have surgery and we have dressing changes that need to be done. And I don't know about you guys, but sending patients home to train dressings without home care or skilled care is not necessarily something we all feel confident in doing. So TCU, again, is there to help with that. And then common medical problems, which we've already touched on, are joint replacement surgery, knees, hips, shoulders, long stays in the hospital for any medical problems, and strokes or other brain injuries. Dr. McCullough, anything you want to add to that list? It's pretty extensive, isn't it? So who is your healthcare team? Who's taking care of you at Coosa Valley? I've already said we've got several friends I noticed today with us. Some of you, I know you from being patients with us in our facility. Others of you, I know as being auxilians in our facility. And others of you are just true and tried friends of CVMC. And we want to tell you who we are, so you have the opportunity to know who your healthcare team is. Well-trained physicians, of course. You guys have seen Dr. McCullough here today, and all of our primary care physicians admit patients to TCU. Dr. Aldahar is our medical director. Dr. McCullough is helping us look at therapies, given his background and his history with therapy. We, of course, have the therapy specialist, physical, occupational, and speech therapy. We have a master's prepared social worker, which is a very important piece of the discharge planning and the continued stay plan. Case management and discharge planning, trained activity therapists, because those activities are important. When you get over to TCU, you're really put on a schedule, and that schedule is what helps you build strength and stamina to go home. And keeping that schedule is important, and making sure that once you finish therapy in the morning, that you're getting to activities before lunch today, because we not only want to keep you physically strong, we want to keep you mentally strong while you're there as well. And then, of course, one of the most important assets we have on our campus is our chaplain, and we think we have the best chaplain around with Glenn Winter. Many of you know Glenn, and he is a real asset to our TCU team. So Vanessa said when she started out, today we're going to be talking about post-acute care. And really, Coosa Valley has divided our inpatient model into two buckets. One of those is acute care, and you know that is the ER, is the ICU. Even acute care includes having babies, is our med-surg units, and then the post-acute, which are our 85 long-term care beds. And those 85 beds, 35 of those are TCU, 50 of those are our nursing home. And so that post-acute world includes transitional care, nursing home, and then, of course, the very important discharge piece of home care and hospice. And I was just talking to one of you and heard you say, hey, I'm getting home care at home to help with my blood pressure. And there are all kinds of opportunities, not only for TCU, but for home care as well, in terms of helping support patients at home. So the home care and hospice piece is vitally important. All right, well, we're going to take a few minutes and let you meet our team. I'll ask our post-acute team to join me up here and introduce this group of folks, because these are the folks that make sure you have a phenomenal stay. You may notice some new faces. We've got some new members of our team, and I'm going to let them introduce themselves to you this morning, tell you what their name is, and then give you their title as well, so you'll know what their role and what their function is. So we'll start in here with Brandy.
My name is Brandy Birchfield. I'm the occupational therapist and the rehab manager.
My name is Stacy Rhodes, and I'm an occupational therapist, and I'm also a rehab manager with the therapy department at TCU.
I'm Shanessa Perkins. I'm the Director of Nursing for the Post-Acute Department, which Ms. Price stated includes transitional unit and nursing home.
My name is Jody Matnicken. I'm the Administrator of the Post-Acute Unit.
Sure, please.
I wanted to cover a couple of topics very specific to from a financial insurance point of view, just to give you a little bit of education on how, a little bit more in-depth education on how that works. a lot of people, including the acute services staff, throw the statement out to you, 20 days, you have 20 days. Has anybody been in the hospital where you've heard the term, you've got 20 days of rehab, whether it's at our place or in a different place? There's a little bit of a catch to that, and it ends up getting some people confused, so I wanted to spend a few minutes and letting you guys understand that a little bit more in depth. And it ties into these folks' area with the therapy or the nursing staff. Medicare guidelines state that you have to have a reason for skilled nursing care. And that could be skilled nursing itself, includes IVs, anything that it requires a nurse to do. It also can include having therapy services. So if you need strengthening from either a physical therapy standpoint, if you've had a stroke and you have to have some swallowing strengthening done where you can swallow better, those are all skilled needs. You have to qualify for it and also show progression with your therapy, or progression with, like, you have a 10-day course of IV antibiotics and you have to go through that 10 days and get the antibiotics. So it takes us and your involvement to make Medicare still continue to pay. So you have to be productive with your therapy. You have to get the IV antibiotics. You have to participate in it, and you have to show that there's a progression of you getting better, which is our goal and hopefully your goal for being in rehab. After the 20 days, you can still qualify for more therapy. It becomes a copay after that. And Blue Cross Blue Shield has offered what's called an F plan. Has anybody ever heard of the F plan for secondary insurance to Medicare? What about C plus? Everybody knows about C plus, right? All right, the copay for after the 20 days, it's standard throughout the United States, and it's $157 a day. That's very, very significant out of most people's pockets. You really just can't afford that. So Blue Cross Blue Shield, even if you have just regular Blue Cross Blue Shield C plus, Blue Cross Blue Shield will allow you to change your C plus plan to an F plan, what they call an F plan. It's a very limited premium increase, per month premium increase, but it covers the $157 a day. So if you needed to stay 60 days, it would cost you a tremendous amount of money out of pocket if you didn't have it, then the premium increase will definitely offset, and you can get that coverage, and it would help you out tremendously. And Blue Cross Blue Shield allows you to do that on a month-to-month basis. So say that you needed to go in effect by November the 1st, and you can call Blue Cross Blue Shield now, and then they'd have it in effect by November the 1st. That's part of that financial counseling part that we do as well. So you can meet with us, and we try to do care plan meetings to help you out and help you to understand that. And I believe that's what I was going to cover.
Thank you, Jody. I also want to mention that Jody might look familiar to some of you. If you're thinking, I think I've seen him before. Jody also runs the local ambulance service with Sylacauga Ambulance. And he has many qualifications and certifications, but he also serves as our nursing home administrator and works with Sylacauga Ambulance on their daily operations too. So he's quite talented in that regard. We're very glad to have him as a part of our team, as well as Shanessa Perkins, who's a new member of our team and has brought great new ideas to us as well. And these folks are passionate, along with our rehab and therapy team. We are passionate about helping you reach that optimum level of functioning so that you can go home and continue with your life and move forward and gain the strength that you need to be independent and to take care of yourself and get back out of the healthcare system. We always say we hate for patients to get wrapped up into the healthcare system, because for some patients it seems like it's very difficult to get out. And that's what rehab does, TCU, skilled nursing care, is it allows you to gain that independent functioning so that you don't have to rely on the healthcare system on a day-to-day basis. And we're very proud of the outcomes we have on TCU. So another important piece, thank you guys, of what we're going to talk about this morning is I asked you guys out of the gate, how many of you have ever visited on TCU? Well, the next question that I have for you is, how many of you have ever been a patient on TCU? I see a couple of familiar faces. Well, you know, we have one among us that we've asked to join us and talk a little bit about his stay on TCU. Dr. Shirley and Dr. Ted Spears have been so supportive, not only from a library perspective of Coosa Valley Medical Center, but Dr. Ted has had some experience with us, and we wanted him to talk to you guys this morning just about his personal experience. Dr. Spears, if you'll join us. He was gracious enough to choose Coosa Valley and let us take care of him, which we were so honored to do. And so we asked him today if we could put him on the spot and get him to tell you a little bit about his stay.
Thank you, Amy. I appreciate the opportunity to talk with you all about the transitional care. But even before we get started, since Dr. McCullough's here, let me start off. Dr. McCullough patched me together so we could get through the Marble Festival and get through the leadership sort of con before he turned me over to Tropiano for a total knee replacement. I've had 2 knee replacements, both of them at the hospital here. And I've been in transitional care, I've been in home care, I've been in emergency care, I've been wherever we happen to be. But my intent was to make sure that how many days that I have left on this earth, that I want to be up walking around enjoying myself. And that's what they enabled me to do. You know, as you get older, you get to worrying about incapacity. And they address that problem in the transitional program here. If you have worries about that, they can handle that. And I'm glad that Amy mentioned the fact that the chaplain, they have a chaplain on staff. Glenn is really wonderful. But one thing y'all didn't do, you need to put on there, is that I found that after I got successfully through the different programs, that if I saw people in the restaurants, if I saw them in the grocery store, if I saw them at Walmart, I said, hey, let me ask you another question. You know, you can call them up at night on the premise that, hey, you may have turned me loose, but I haven't turned you loose. So we listen. So they'll answer questions. They're real good about it. And I know that Amy and Vanessa and all the rest of them get excited, especially Tanya, since she was one of the people that put me through torture on my first transition. And you know, I found this out to be, and this is very true. Because of the transitional, when I'm up walking around, every morning when I walk my 2 miles, I go to the hospital and I look up there. This morning the sun was shining on the glass, and I almost could see Andy's image in the glass up there. But you know, I'm thankful for that sort of thing. But Dr. McCullough was wonderful, Tropiano was wonderful, the nurses and all that. But those physical therapists all going to hell, I can tell you that. I will have to admit that because of I am walking around very well. But one of the interesting things that, there were other things that I participated in. I'm the director of the Leadership Silicaga program, and every year we take the entire class to Coosa Valley, and they get to go through every facet of the hospital. Vanessa and Amy sees to it that we have full run of the place, that they show us everything, and everybody in that class will come out and say, I didn't know that was such a wonderful place. Why didn't I know this before? Well, probably because people like me didn't tell them. But I can tell you that for the last 8 years, I've made it a point to talk to these people at length about what a gem that we have at the Coosa Valley Medical Center, and that they can do almost anything that anybody else can do. And I just appreciated the opportunity so much to say a few words. But the main thing, I've had numerous people say, well, you know, if I'd known that, I wouldn't have been going to Birmingham. Of course, since that time, the traffic gets worse and worse. You can't get to Birmingham anyway, like in hospital. You better take a good second look at us here in Silicaga, because that is just something absolutely wonderful. And as we age and as we have more needs, I want to be close to home, so I pick up the phone and call Amy and Vanessa and Andy and Glenn Glenn, especially Glenn Winter, because I'm thinking more about that aspect of it anyway. But I really think that we are just lucky to have the facility that we have, and I can't say enough. And when I walk off from here, Lee Perryman came into the library the other day and he said, "Well, how's your knee?" I said, "I'm just doing wonderful." He said, "Can you dance?" I said, "I can now." He said, "Could you dance before?" I said, "Absolutely not." But there's a lot of benefits to being at home where you can see the people that care about you, you know that they're going to take care of you. And so I congratulate the entire staff at Coosa Valley Medical Center that we appreciate you and you do the best job that can be done. Thank you so much.
Thank you, Dr. Ted. I appreciate your comments. Vanessa, I think you went off script there on that physical therapy piece, didn't you? Dr. McCullough is going to close us out this afternoon. I just wanted to leave you with one thought before Dr. McCullough wraps us up. And Dr. Ted hit on that. We know that you have options in healthcare, just like you have options about where you buy cars or shoes or groceries for that matter. We know that you have options in healthcare. And we want you to choose us. We don't want you to be sick. We don't even really want you to need us. But when you do have a need, we want you to have Coosa Valley Medical Center at the top of your mind. It is our privilege to serve our community. We're some 645 team members strong now. Many of them are here today. We take serving our community very seriously. We are serious about meeting your needs. Mr. Sisk, you guys know our CEO is very passionate about meeting the needs of this community. Not only meeting your needs, but gaining your confidence so that when you do have a need, you've got a peace of mind that you know we're going to be there and we're going to be responsive to you and your needs. All right, Dr. McCullough, I'm going to turn it over to you. We need a drum roll.
Well, a lot of you guys know who I am, and I'm not going to take a lot of your time, but I just want to say what a privilege it is to come and speak to you again. This time it's about something that's very near and dear to my heart. Those of you who don't know me, I used to be one of those hell-bent physical therapists before I went back to medical school, and I guess that's part of my personality is you're gonna get your knee straight. So they're not that bad, Dr. Spears. they have a job, and we need to get they're going to plow through it and try to get that job. And if you hurt, that's okay. Take care of it. But yes, I was a therapist, and I enjoy that so much. I tried to put that back into my practice when I came back here. And one of the ways to do that was I just showed up over at the TCU one day and started seeing patients over there. And I go over there twice a week to see patients that are in there for mostly orthopedic problems and things like that. And my goal is just to make sure you're getting what you need. And we have a meeting every week. We talk about our patients. We see what's going on, where they're going, and what the plan is for them. There's a lot of planning that goes on. If you haven't just picked up on that, there's a lot of planning that goes into taking care of people at the TCU. And so the goal is, if you hadn't already taken this away either, there's two things really. Make sure you're safe. Okay, we don't want you leaving the hospital, leaving that place unless you're safe. We don't want anybody falling or misusing equipment or anything like that. The next one is that, can you take care of yourself? And those are probably the biggest ones. We want to make sure that you're safe, and then you can do things for yourself. You can dress yourself. You can get out of bed. You can go to the bathroom by yourself if you need to. Okay, and so that's really the main thing that we focus on. Are you meeting those goals? And so every week we meet and we talk about every patient, and that's where we want to see you get to. And a lot of the strengthening and things, some of that comes afterwards. People go to home health or they go on to therapy at a clinic, and they really gain what they need to make their knee more functioning. Before that, though, when they're in our place, we want to make sure that they can move around,